I don't know about you, but the thought of having surgery scares the living daylights out of me. I'm always amazed that people turn up on the day. Some of them tell me they're terrified and they feel like running away. I say to them, I don't blame them, and I'd feel the same if I were in their position. This can often come as a bit of a surprise. Why are we so anxious about having treatment that's meant to relieve us of pain and make us feel better? I had to have a kidney stone dealt with a few years ago. It involved having a tube passed up through the bladder and into the kidney. The stone is heated up with a laser. This basically blows it up. I had the surgery done by a surgeon I knew well in one of the hospitals where I do my private practice. I was mortified at the thought of the people I worked with seeing bits of me that, let's say, they hadn't really seen before. It was this, rather than the thought of the surgery, that made me feel so anxious. I knew that I'd be looked after extremely well and that I was safe in the hands of people who were professional, kind, and just wanted to do the right thing for me. Once I stopped fighting my embarrassment and surrendered to the process, I felt so much better. For you, it might be that the thought of having a serious complication is the thing that keeps you awake at night. If you've got a painful hip, you're probably feeling pretty grim well before you come into hospital. You haven't slept well for months, the painkillers make you feel lousy, and you wonder how on earth you are going to cope when it's all done. Sometimes the feelings of doom and gloom just keep popping up when you least expect them. It's maddening. So how do you deal with it? Well, there's lots of advice online about how to manage it, but to be honest, not much of it is that helpful. So where do we start? Well, doctors like to categorise treatment. In the case of preoperative anxiety, the treatment can be pharmacological, that's using drugs, or non-pharmacological. These drugs can help to reduce anxiety, but they're probably best avoided before surgery. They make you drowsy and might interfere with the anaesthetic drugs that you're given. What about non-drug treatments? Most of them are just ways of trying to distract yourself, to be honest. They help you to confront your feelings, deal with them as best you can, and stop them getting out of control. People try things like acupuncture, massage, aromatherapy, and hypnosis. It all sounds like a bit of a faff to me. And anyway, it's just something else that you're going to have to organise and deal with. They're worth looking at though, as you might find something that works for you. If the thought of having hip surgery terrifies you to the extent you aren't even able to consider it, then you probably need psychological support. There is some evidence that things like cognitive behavioural therapy can help, particularly in severe cases, but it can take a long time to work. In less severe cases, my advice to you is to speak to your surgeon well before the surgery. Tell them how you feel. If it's the thought of the anaesthetic that worries you, we can arrange for the anaesthetist to speak to you well in advance of the operation. Just knowing what's going to happen on the day of surgery can really help a lot. Share your feelings with your friends and family. After all, a problem shared is a problem halved, although with some families, that's not always the case. You aren't alone. Studies have shown that most people have varying degrees of anxiety before surgery. Some people are more susceptible than others, but as you get older, it becomes less of a problem, and that's quite reassuring, really. If you'd like more information on this or anything else about hip surgery, please get in touch. The details are below. Thanks for watching. See you again next time.